Memorial Day weekend is already setting pandemic travel records. The TSA says more than 1.9 million people were counted at U.S. airports on Friday. The last time that many people flew was March 2020, the month most of the country shut down due to COVID. In total, AAA says 37 million people are expected to travel more than 50 miles this weekend. That's a 60% increase from last year, when much of the country was still under lockdown orders. The rush to travel comes despite the highest gasoline prices on Memorial Day in 7 years. The average price of a gallon of regular is now more than $3. The travel surge comes as more people get vaccinated against COVID-19. Just over half of all Americans have had at least one dose, and more than 40% are now fully vaccinated. CBS's Michael George reports on the effort to reach that other half.
Going to the beach this weekend? New York health officials' mobile vaccination van will be there too. It was perfectly situated for Marie Giovanni and her daughters.
I was waiting for them to do it, so the sooner I heard they're doing for 12 and 14 years old, I was like, okay, why not?
The effort to meet people where they live made the difference for David McCallum.
Because they're here, if someone knocked on my door and said, it must be meant to be, let me go get a shot.
Bringing the vaccine to people is what's going to get us to where we need to be.
Just about half of U.S. adults are still not fully vaccinated, but it's within distance of President Biden's goal of 70% vaccinated adults by July 4th.
We have to reach those who are not vaccinated and make it as easy as possible for them to get protected.
It's become a place-by-place, state-by-state process.
I'm proud to say that 66% of Virginia adults have had their first shot. Virginia will hit President Biden's goal.
Vermont leads the nation with almost 50% of its population fully vaccinated. And with numbers edging higher, so are the numbers of people hitting the road this weekend.
As more people get vaccinated, they're becoming more comfortable with the idea of travel, but there's still some travel hesitancy.
And with good reason, according to Dr. Eileen Marty.
I am very concerned about people who are not vaccinated, who think that because the rates are down, they're off the hook. They don't need to get vaccinated and they're not going to get sick. They're wrong. They could very well get sick. They could very well end up in the hospital. They could die.
Dr. Anand Swaminathan joins me now with more. He's an assistant clinical professor of emergency medicine at St. Joseph's Hospital in New Jersey. Dr. Swaminathan, thanks for being here. So after several holiday weekends in the past year, we saw spikes in coronavirus cases. I'm wondering, are you concerned about seeing another spike in the coming days, or do you believe that we are past that with our current vaccination levels?
I think we can still see spikes, and some of this is going to depend on where in the country we are. In states where vaccination rates are high, 60, 70% with at least one shot, I think it's unlikely that you'll see any kind of spike because we've seen a massive reduction in cases in those areas, 40, 50% reductions. But there are pockets of the country where vaccination rates aren't high. And in those areas, cases are actually going up over the last 2 weeks. And those are places where really there is the opportunity to have some spikes after travel weekends. And, it's not just the travel itself. Yes, you should be masking when you're traveling. But once you get to your destination, it's all of the things you do when you're there. The fact that you have to eat out. It's more exposure, the fact that you're in crowded areas. So I think there's still a lot of places where people need to continue to be careful. If you're fully vaccinated, you're probably okay to travel, and that's going to be safe. But remember, a lot of us are traveling with kids who are younger, who aren't vaccinated. They're at risk. They're at risk for spreading to others. I think there's the real opportunity to see spikes, but I think those spikes are going to be in pockets and not across the country.
What sorts of precautions do you want to see people take as they travel this weekend?
I definitely think that we're in any kind of a crowded situation, you need to be masking. So whether that's in airports, on a plane, on a bus, on a train, however you're traveling, keep your mask on. Even if you're vaccinated, I think it's a good idea to keep your mask on, not necessarily because you're going to contract COVID and get sick of it, but it's a signal to everyone else around you that you are looking out for everybody's health. That kind of social cue is going to help to everybody to mask up. So I think that's an important thing. And then wherever you're traveling to, if you're unvaccinated, try to avoid crowds, stay outside if you can for dining, or even better, if you have any kind of ability to eat if you're renting a house or something like that, eat inside is going to be safer in those kind of settings as opposed to eating out in restaurants where we know that there is the real likelihood for spread.
I also want to ask about the CDC's guidance on children attending camps this summer. Vaccinated kids age 12 and up don't need to wear masks, but things get a little more complicated for camps with younger children who can't yet be vaccinated. So what should parents be thinking about if they want their kids to attend camp?
There are some good recommendations in those CDC updates that came out this last week. If they're outdoors, kids are going to be safe in general. Unless it's a very crowded kind of setting, they can't space apart at all, it's going to be okay to go unmasked. But indoors, I think the CDC recommendations could have been a little bit clearer. It should be 100% masking indoors if you're unvaccinated. And again, for the social cues, let's just keep everybody masked indoors unless you happen to be at a camp where you know that everybody is vaccinated. Unless you're in that unique situation, it's just safer to keep everybody in their masks. If the older campers, even if they're vaccinated, if they're wearing masks indoors, it's going to signal to the younger campers that this is the norm. This is what you have to do. It's that social cue that we need to maintain. And then the other things that we can do is if you have kids 12 and up, get them vaccinated. We have time. July 4th is about 5 weeks away, which means that if you take your kid today to get the first shot of Pfizer, they can be fully vaccinated before July 4th. Hopefully, they can be fully vaccinated before they go away to camp. So this is our opportunity. Take those opportunities when we can. Get your kids vaccinated now so that when they go to camp, they're protected. The more kids that are vaccinated, the more they protect everybody else at camp, and the less likely those camps get shut down and your kids get sent home.
So how close are we to having the research to conclude if children younger than age 12 can be vaccinated?
I wish that I could say that we were close. I think it's going to be a little longer, unfortunately. I've got two kids under 12. My 12-year-old already has his first shot, has his second shot coming up on Thursday. My younger two are going to have to wait a little longer. I think a lot of us are hoping that we get that data, we see that data by September, and hopefully it goes up for EUA sometime early in the fall, but it might be delayed a little longer than that. And this is the right thing. We need to wait, make sure that we collect good data, that we follow kids up, make sure they're not having significant adverse outcomes or adverse events. And that's the best way to protect our kids, both from the vaccines, but then also to protect them from COVID. So I think most of us, many of us, are hoping for early fall. Might be a little bit longer than that, but definitely by the end of the year, we're going to have that data, and hopefully we're going to start vaccinating kids based on that data.
All right. Memorial Day weekend is obviously looked at by many people as the unofficial start for summer, even though it doesn't particularly feel like it at this moment. But I'm wondering if you're particularly confident about the state of the pandemic in the U.S., or are you concerned about how tough it will be to vaccinate the remainder of the country?
I'm very optimistic, but I think we also need to be cautious with that optimism, and we need to continue to push to get more people vaccinated. Again, when we see the states where vaccine rates are high, we see massive declines in cases, and that protects everybody, even those that can't get vaccinated for whatever reason. I think what we need to be pushing now is to clear up access issues. So delivering more vaccine to places that people are, more pop-ups, more mobile units. We need to really be supporting people in getting vaccinated. So they should be getting paid time off to get that vaccine if they need a day off afterwards, because a lot of people do get some adverse events, minor adverse events afterwards. Give them the day off afterwards. Those things we can do to really boost the number that are vaccinated, because there are a lot of people who still do have access issues who haven't gotten vaccinated yet. And then for those that are hesitant, we need to get out and continue to communicate with community leaders, with people directly about what their concerns are, see how we can clear that up. But the easier that we make vaccination, the more people that are going to get vaccinated. So clear up those access issues, really get out there and talk to people, talk to community leaders, align with them, find out what people's concerns are, and we need to address them. But I'm hopeful that we can have a really good summer if we continue to push with our vaccine rates.
All right. Dr. Anand Swaminathan, thank you for being here, and thanks for all that you do.
Thank you very much.